Hi friends, welcome to the International Translation Health Store. My name is Prisha, and today we have Prenatalin on the hot seat. Before we start with this review, please subscribe our YouTube channel. Thank you. This review will be in Hindi language and English. Let's get started with this review. When a happy couple decided to have a baby, there are many things can goes right, and there many things can goes wrong during pregnancy. Here are some of the complications during pregnancy. High blood pressure, also called hypertension, occurs when arteries carrying blood from the heart to the body organs are narrowed. This causes pressure to increase in the arteries. In pregnancy, this can make it hard for blood to reach the placenta, which provides nutrients and oxygen to the fetus. Reduced blood flow can slow the growth of the fetus and place the mother at greater risk of preterm labor and preeclampsia. 2. Women who have high blood pressure before they get pregnant will continue to have to monitor and control it, with medications if necessary, throughout their pregnancy. High blood pressure that develops in pregnancy is called gestational hypertension. Typically, gestational hypertension occurs during the second half of pregnancy and goes away after delivery. Gestational diabetes occurs when a woman who didn't have diabetes before pregnancy develops the condition during pregnancy. Normally, the body digests parts of your food into a sugar called glucose. Glucose is your body's main source of energy. After digestion, the glucose moves into your blood to give your body energy. To get the glucose out of your blood and into the cells of your body, your pancreas makes a hormone called insulin. In gestational diabetes, hormonal changes from pregnancy cause the body to either not make enough insulin or not use it normally. Instead, the glucose builds up in your blood, causing diabetes, otherwise known as high blood sugar. Managing gestational diabetes by following a treatment plan outlined by a healthcare provider is the best way to reduce or prevent problems associated with high blood sugar during pregnancy. If not controlled, it can lead to high blood pressure from preeclampsia in having a large infant, which increases the risk for cesarean delivery. Infections, including some sexually transmitted infections (STIs), may occur during pregnancy and/or delivery and may lead to complications for the pregnant woman, the pregnancy, and the baby after delivery. Some infections can pass from mother to infant during delivery when the infant passes through the birth canal. Other infections can infect a fetus during the pregnancy. Many of these infections can be prevented or treated with appropriate pre-pregnancy, prenatal, and postpartum follow-up care. Some infections in pregnancy can cause or contribute to pregnancy loss, miscarriage, before 20 weeks of pregnancy. Ectopic pregnancy, when the embryo implants outside of the uterus, usually in a fallopian tube. Preterm labor and delivery, before 37 completed weeks of pregnancy. Low birth weight birth defects, including blindness, deafness, bone deformities, and intellectual disability. Stillbirth, at or after 20 weeks of pregnancy, illness in the newborn period, first month of life. Newborn death, maternal health complications. If you are planning to get pregnant, talk with your healthcare provider about getting vaccines and vaccine boosters for chickenpox, also called varicella, and rubella, also called German measles, before you conceive. You can also get some vaccines, such as the flu shot, while you are pregnant. If you know you have an infection, such as an STI, talk with your healthcare provider about it before you conceive to increase your chances of a healthy pregnancy. Early prenatal testing for STIs and other infections can determine if the infection can be cured with drug treatment. Or, if you know you have an infection, tell your pregnancy healthcare provider about it as early as possible in your pregnancy. Early treatment decreases the risk to the fetus and infant. Even if the infection can't be cured, you and your healthcare provider can take steps to protect your health and your infant's health. What is Prenatalin? Prenatalin is a set of 2 prenatal supplements for pregnant, breastfeeding mothers and trying to have a baby mothers. It contains the products, a vitamin and mineral complex and a set of omega-3 fatty acids, DHA, from fish oil. Prenatalin contributes to the growth of maternal tissues during pregnancy and the reduction of feelings of fatigue and tiredness, thanks to the presence of folic acid. It supports the normal development of the brain and eyes in the fetus and breastfed infants due to its docosahexaenoic acid content. In addition, it increases the absorption of iron due to the presence of vitamin C. Let's take a look at the ingredients for Prenatalin. Highest quality ingredients. Quaternofolic. Quaternofolic is an innovative, most biologically active form of folic acid. A key ingredient for normal fetal development, essential for DNA synthesis and repair. Influences brain and spinal cord development, contributes to red blood cell production and amino acid metabolism. Folic and quaternofolic. Compared to folic acid, quaternofolic has a higher bioavailability, stability, and faster effect. A folic acid deficiency in a pregnant woman can lead to serious birth defects in the child, such as neural tube defects. In addition, it can contribute to an increased risk of premature birth and fetal malnutrition. Fish oil. Top quality fish oil, which is a source of omega-3 fatty acids, EPA and DHA. DHA is essential for the formation of brain structure and proper development of the nervous system. Has a positive effect on cognitive function and intellectual development. Influences eye development, helps form the retina of the eye. EPA supports the functioning of the cardiovascular system. Supports immune system function, reduces the risk of postnatal depression in women. Selenium. Select an innovative form of selenium with increased bioavailability. Plays an important role in the regulation of the thyroid function. Supports the functioning of the immune system, supports brain and nervous system development. Adequate selenium levels in your diet reduce the risk of postpartum thyroiditis in premature birth. Vitamin K7. Naturally derived vitamin K of the highest quality and bioavailability. Plays a key role in bone mineralization, provides protection against congenital heart defects. Essential for proper blood coagulation, has a beneficial effect on the cardiovascular health of both the fetus and the mother. Aquaman. Apanjikrit Vyapar Chinha TGA multi-mineral complex from calcareous marine algae that provides a natural source of calcium. Plays a key role in the development of the skeletal system, has an impact on bone mineralization. Supports the proper functioning of muscles. Calcium deficiency may cause growth retardation in the fetus. Magnesium. Aquaman Apanjikrit Vyapar Chinhar MGTG magnesium from a natural mineral source derived from seawater. One of the most important elements for human life. Contributes to the maintenance of electrolyte balance and conduction of nerve impulses. Is essential for women during pregnancy and after childbirth due to the increased demand. Choline helps prevent neural tube defects, supports the normal development of the nervous system and brain. Plays an important role in the transport of nutrients across the placenta. Iodine participates in the production of thyroid hormones. Increases a woman's chance of becoming pregnant. It is essential for the maintenance of pregnancy and the proper development of the fetus. Vitamin A takes part in the process of tissue growth. Influences the development of vision, lungs and bones in the fetus. Supports the proper functioning of the mother's immune system. Vitamin D plays an important role in bone mineralization in the fetus. Supports the development of the immune system. Deficiency can lead to neurological disorders in the child. Vitamin E protects cell development from oxidative stress. Supports the function of the immune system. An adequate supply of vitamin E helps to reduce the risk of miscarriage. Vitamin C supports the normal development of the fetus. Increases the absorption of iron. Participates in the synthesis of collagen. Thiamine contributes to the normal development of the fetus. Helps relieve neuropathic pain. Promotes the healing process of wounds. Riboflavin participates in the production of neurotransmitters. Influences the development of the nervous system and brain. Helps provide the energy necessary for the development of the fetus. Niacin participates in the DNA synthesis process. Supports the production of hormones responsible for the normal development of the baby. Vitamin B6 supports the absorption of folic acid and iron from food. Participates in the process of blood cell formation. Contributes to the absorption of protein by the body. Vitamin B12 takes part in the production of red blood cells. Reduces the risk of premature birth. Is essential in the synthesis of transmitters. Biotin supports the maintenance of hair and skin in good condition. Participates in the development of the child's immune system. Is essential in the body's metabolic processes. Iron. Participates in the production of hemoglobin. Reduces the risk of hypoxia. Reduces the risk of low birth weight and prematurity. Zinc. Essential for normal growth and cell division. Supports immune and nervous system function. Deficiency may result in low birth weight. Copper. Takes part in the production of red blood cells. Supports the development of the immune system. Plays an important role in the production of neurotransmitters. Manganese. Essential for normal fetal development. Participates in the process of bone development. Contributes to the production of antibodies and the action of antioxidant enzymes. Chromium. Essential for maternal health, helps regulate blood glucose levels. Supports the regulation of lipid levels. Helps to counteract gestational diabetes. When can I start taking Prenatalin? You can start taking Prenatalin as soon as you start trying to have a baby. This way, you will provide yourself with the nutrients you need to support your body during and through all stages of pregnancy. You can take Prenatalin for as long as needed, and you can start taking the supplement at any time during your pregnancy. How to use Prenatalin? Prenatalin Multi. The recommended daily dose is 2 capsules, preferably with food. Take the product with approximately 300 ml of water. Prenatalin Omega 3. The recommended daily dosage is 1 capsule, preferably with food. Take the product with approximately 300 ml of water. Can I take Prenatalin even after my baby is born? Yes. You can take the product even after the birth of your baby. Breastfeeding is a time when your nutrient requirements increase significantly. Additionally, the vitamins and minerals present in the product are passed on to your baby along with your milk, which aids in the normal development of your baby. What happens if I forget to take Prenatalin? Regular intake is recommended, but don't worry if you forget to take your daily dose. Simply take Prenatalin the next day and continue taking it as directed. Do not take more than the recommended daily dose on consecutive days to make up for a day or days on which you missed taking the product. How many capsules are there in a set of Prenatalin? 1 pack of Prenatalin Multi contains 60 capsules, while 1 pack of Prenatalin Omega 3 contains 30 capsules. This amount is enough to supplement 1 month. How long do I have to wait for my order? Shipping of the order will be completed within 24 hours of placing the order. The product will be delivered within a few business days. Is international shipping also available? Yes. We can also send our products abroad, and International Translation Health Store discount on January 12, 2024, and please scan the QR code for the discount.